As a family practitioner, obviously I get to see everything. We're the gatekeepers, right? And of course, I'm interested in seeing what everyone else has to say today, because ultimately it's my job to diagnose and at times push them to the specialists. And of course, when we talk about diabetes, there's a lot of work to be done. But when I see the diabetic patient in my office, they've got the heart disease, they've got the strokes, they've got the cancers, they've got the peripheral neuropathies, and they're sent to the neurologist. And they're finally ultimately in so much pain that sometimes they have to go to the pain doctors. So I definitely see them getting worse at times, and sometimes if there was a prescription to give to them to not have to send them, with all due respect to my specialists here, I would like to see them get better with their diseases. When some of the data that I've looked at before, when you see in America, like every 50 seconds, someone becomes a diabetic. As a child is born, 1 in 4 risk of that baby becoming a diabetic. It's mind-boggling. In this particular talk, we're going to be talking about type 2 diabetes. And of course, in the diabetic world, type 1, there'd be about 5% of the diabetics, 90% are the diabetic type 2s. Some of the statistics I'll share with you before I get into the videotapable slides is it contributes to about 160,000 deaths per year. It's the number 1 cause of adult blindness, perhaps, in the world. Over 50,000 diabetics on dialysis or transplant per year. When you look at those data and the ones that I'm about to share with you now, it's mind-boggling. Let's look at the next one. The cost to society. If you look at the chart here, what stands out is that $5.1 billion. Now, we're going to be centering just here in Washington alone. Can you imagine in the country? Can you imagine in the world? But this particular data here shows a $5.1 billion cost to Washington. In the cases, if you look at the incidences of the diseases, it's not the highest. Obviously, the obesity and hypertension is up there. There's only about 430,000 cases, yet it contributes to 5.1 billion. Amazing. If you look at the potential benefits of someone like myself or my associates here trying to treat this diabetic patient, those same 430,000, if you were to go ahead and treat them with a vegetarian diet, this particular study shows that there is a decreased risk of what? 78%. And if you look on that slide, it's the highest there. A particular study in 2012, again, what I'd like to do is focus on the diabetes, 5.1 billion. With a potential cost savings, 3.98 billion. Again, if you look on that list there, it is the highest. Conclusion, that if we go ahead and focus on diabetes as one of the things that I focus on, it can make a big difference, impact in society. Of course, we're all giving talks on vegetarian diet, but for those who are listening on the video, what is a vegetarian diet? Well, some confusion may be there, but there is a vegetarian total vegan diet based on plant-based fruits, vegetables, whole grains, legumes, and nuts. Some vegetarians may consume eggs and dairy, but in general, the vegetarians don't eat the meat, poultry, fish. Of course, a cardiologist who spoke about Dr. Ornish, but he was stated to have said this, and I would tend to agree with this: more than 75% of the $2.8 trillion in annual U.S. healthcare costs are from chronic diseases, one of which is diabetes, which can be prevented, and what I like him saying is reversed by eating a plant-based diet at a fraction of the cost. There are a few things that I know that we can reverse. Now, for my patients, what I do like to say is, once you have the diagnosis of diabetes, if you get it controlled, it is diabetes diet controlled. So sometimes when they have that diagnosis, they do have to make sure they watch out. When I looked at this slide, it was with Dr. Roberts saying, although we think we are one, and we act as if we are one, human beings are not natural meat eaters. Flesh was never intended for human beings who are natural herbivores. And I was looking at that, and I was sharing with the audience earlier today that what is an herbivore compared to an omnivore versus a carnivore, right? Carnivore eats primarily meat, like tigers and lions. Omnivore would be something like a bear, right? Which eats berries and yet can eat meat as well. An herbivore is obviously one who would primarily eat vegetation. And yet, if you look at our human anatomy, and you look at the bear anatomy, and you look at the tiger anatomy, you find that our body is very similar to the herbivore, like the cow or the horse. Teeth flat for grinding, a longer GI tract, the acidification process. You were wondering why we were built a certain way. Perhaps he was right on. As I see my patients on a yearly physical, I tell them, make sure you come in for a physical. It's free. It's your insurance going to cover it. I check their fasting blood sugars, and I look at that every year carefully. And if it's over 126 fasting, 12-hour fasting, I'll tell them, Mr. Jones, Mrs. Smith, I think you have diabetes. We'll check it again with hemoglobin A1C, 6.5 and above. If they came in that day, let's say they weren't fasting, they were coming for just a routine follow-up from another visit for something else, they needed blood work, and they checked their chemistries and the sugar was 200 or greater, I'd say, Mr. Smith, Mrs. Jones, you might want to come in and recheck that again because I think you've now developed diabetes. Can you imagine? Half of the adults walking around are currently undiagnosed. Just because they don't have the symptoms doesn't mean they don't feel it. Like hypertension, like cholesterol, diabetes, I tell them it's a silent killer. You don't have to feel it for you to have it, and that's why it's important for them to get checked. Some of the symptoms that people will experience, the polydipsia, excessive thirst, right? Drinking everything they can get a hand on, drinking down the milk, drinking down this orange juice, drinking down the water, whatever it is, they feel thirsty all the time. And they're also urinating a lot too as well because of all that concentrated glucose spilling out. Polyphagia, eating a lot. And sometimes I'll tell my patients, if you suddenly lose a lot of weight too, because of all that sugar that you're spilling, they'll notice that they're actually losing weight. Then they don't know why. Again, half the people, 7 million, are out there probably walking around today not knowing that they have the diagnosis of diabetes. In a 2004 and older journal, women who ate more red meat were 28% more likely to develop diabetes than peers who ate the lowest amounts. And as you saw, there was a trend in this country from 1960 to 2010. You'll see this rise of meat consumption. And you'll see why we have this epidemic of obesity and this epidemic of diabetes. If you look at this slide, for the adults, ages 20 years and older, this is the prevalence. It's a pretty big number, 25 million. Those who are 65 and older, 10 million. That's almost what? A third? If you were to go ahead and implement a vegetarian diet, a vegetarian diet, a semi-vegetarian diet, a vegan diet, you can see the benefit. Now, I had a raise of hands of all the people here at the audience, and not everybody was vegan. Not everyone was vegetarian. Some were semi-vegetarians. But I said, if you have this process of where you're at now, and it's like the target, and I explained to them the target. If they're out here, step in closer to the target. Someone may have visited a cardiologist, triple bypass, someone was diagnosed with cancer, and I'd say, well, maybe for you, we're going to implement the target diet. This particular study shows the relative comparison of BMIs. And then if you look at the top level there, top line, the non-vegetarians, the BMI average, that's the average American diet, 28 BMI. If the diabetes was 1 and hypertension was 1, implementing a semi-vegetarian diet will grant some benefit. A pesco-vegetarian diet, those who primarily would eat fish as their meat source, would also improve their diet. BMI goes down, incidence of diabetes goes down, hypertension would go down. But if you go down to the lacto-ovo-vegetarian and finally to the vegan, you can see that progressively, again, that target. And this is what I wanted to share with the patients. I said, if you can do this process and gain the benefit, Look at that. That would be the target diet that we'd want to shoot for. A little busy slide here, but I want to point out a few things. The hemoglobin A1C is a blood test that we check for our diabetics, right? Some of you will be familiar with it. It's kind of an average blood test that we get for an average of about 4 months or so of how high the sugars would run. And if you look at that hemoglobin A1C change, again, when a patient comes in, about every 4 months, we'll check that hemoglobin A1C. Our goal for most of my patients is 7, but that's if they're doing a good job. I would like them to be down to 6.5. But with just the American Diabetic Associated diet, it's a 0.38 points decrease in a hemoglobin A1C. Metformin, which is the medication that we start most of our diabetic patients, granted that they don't have kidney disease or because they don't have some sort of side effect of intolerance, usually GI issues, diarrhea and upset stomach. But after diet and exercise, American Diabetic Associations and the American Endocrine Society, they recommend metformin as a first go-to drug, right? As soon as they develop diabetes, got to pull it off. Liver issues, we may have to pull it off. But again, that only contributes to a 0.6 point decrease. Most of my patients are not just on metformin. And I think most of your patients who come to your clinic probably have multiple meds. And we do have quite a few medications this time to offer our patients, but today's lecture is not on the medications. The low-fat vegan diet, 1.2. Twice as good as a medication provided by metformin. And if you look at the weight loss, there's an increased weight loss. The reduced LDL, low density. The urinary albumin, when diabetics get progressive diabetes, they will start to develop proteinuria. Proteinuria is where their kidneys start to deteriorate and release some of the proteins that it's supposed to reabsorb. It can't. And it basically, like little holes in the kidneys, it will let out the proteins into the urine. Evidences of progressive disease. And what the low-fat vegan diet will contribute to is holding on to those proteins. And that's what that slide shows. The nice thing about that last slide there, last column, a 43% reduction in medication. My patients like that, and I like that. Just a point on obesity. Vegetarians have a 45% decreased risk of being overweight. Vegans have a 65% decreased risk of being overweight. And vegans lose on average, or vegans are about 30 pounds thinner than the average. Peripheral neuropathy. I had a patient that came in, fingertips burning, toes burning. They progressively get worse and worse, and eventually they can't feel anything at all. And then those are the patients who end up coming in with amputations and progressive disease there. But the patients who are complaining of severe pain, diabetic neuropathy, this is just a few of the medications that we put some of the patients on just to control the pain. Tricyclics, antidepressants, SSRIs, anticonvulsants, Neurontin, gabapentin, antiarrhythmics, and of course opiates, Vicodin, Norcos, Percocets, morphine. And as we all know, there's a myriad of side effect problems with those. I have a patient who have to be started on a medication with gabapentin. Of course, they swell up or they have appetite issues. Then we got to give them another medicine for that. The tricyclists, they have issues with all those problems, and we have to give them medication to counter that. And it's just a vicious cycle, Why not do this? An effective treatment for peripheral neuropathy. A vegan diet, this particular research shows an 80% decrease in pain by 1 month. A 65% decrease in medications for those diabetics and those medicines that I would give to those patients. And a 71% pain-free after 4 years. Now, some of the patients don't always get this benefit. And of course, you have to take a case-by-case situation for every patient. But I will tell you, patients will benefit As we all know, I guess my quote for the day, Hippocrates, as we all know, let food be thy medicine, and medicine be thy food. And I think that what ends up being the goal for my patients, as I told them over and over again, is remember that target, that bullet. If you're out here, go to here. From here, go to here. And ultimately, the benefit of the vegan diet, the plant-based diet, is obviously what we're going to be talking about today. So it's a short talk, focused on a few ideas, but the slides here that were shared today can be found on these websites. And I think that if you have chance, the full paper is on there as well. Have a good evening.